Okay, so today we are going to discuss bleeding pseudoaneurysm. Male patient known case of HIV, hepatitis B, CV, presented with red groin mass after injection in groin. Which types of virus is HIV? Single-stranded RNA retrovirus family, genus lentivirus. What are the subtypes of HIV? HIV 1, 2. More common, 95% of all infection is HIV-1. HIV-2 is less common, less infection, and progress is more slowly, mainly found in the West Africa. Uh, what are the characteristics of HIV? What are the characteristics of HIV? So, single-stranded RNA retrovirus has reverse transcriptase enzyme, transmitted sexually by needle stick injury vertically from the mother to fetus by transplacental birth canal and breast milk. What is aneurysm? It is an abnormal dilatation of artery more than 1.5 times of its normal diameter. More than 1.5 times of its normal diameter. And causes of true and false pseudoaneurysm. Causes of true and false pseudoaneurysm. So true, congenital morphans, Ehlers-Danlos syndrome, acquired smoking, atherosclerosis, hypertension, cause fibrinoid necrosis of subintimal layer, infection, terticephalus, and aortitis. Terticephalus and aortitis. False. Trauma, intravenous drug users, horse riders, popliteal aneurysm, and surgery. If you have done surgery or you have passed catheter in the groin to femoral vein, so this can cause false aneurysm. So okay, so false aneurysm or pseudoaneurysm, which layer is affected in pseudoaneurysm? Subintimal layer. For example, this is the lumen, this is the intima, this is media, this is adventitia. So in true aneurysm, all the layers are involved like this. Okay, all the layers are involved, but in false, it's only the outer layer. The other two are okay. So accumulation under the outer layer, subintimal layer, the medial layer. So it's confusing. Wait, let me clear it again. It's a bit confusing. Some people got it wrong. Actually, what happens is that this subintimal layer, for example, this is your mucous layer, endothelial layer. Actually, the problem here in these two, breakage, this is normal, but blood accumulation occurs here and this get enlarged. So people think it's no, this is here. The problem is here, subintimal layer. So these are the pseudoaneurysm. Sorry, these are the true aneurysms, and this is pseudoaneurysm, false aneurysm. See, this subintimal the outer layer is intact. Why does he have bleeding? Why are clotting factors not working properly? Why is there bleeding tendency in HIV patient? So in HIV patient, there can be trauma which can lead to bleeding. Thrombocytopenia through immune-mediated destruction of platelets and megakaryocytes impair hematopoiesis due to infection of stromal cells within bone marrow, suppression, and immune-mediated inhibition of bone marrow. So what happens that HIV virus infects the stromal cells in the bone marrow and megakaryocytes. So all, and also since when, let's suppose this is a normal cell and HIV goes inside this cell, infect this cell, so body immune system is against this. So actually they are killing the cell because HIV is hiding here. So this is immune-mediated destruction of the platelets and megakaryocytes. Dysfunction of vascular endothelial cell leading to activation and consumption of coagulation factors. Endothelial cells are damaged, so they are causing the consumption coagulation. HIV-related liver disease and decreased coagulation factors production, especially vitamin K deficiency. So what happens that when the HIV viral load is increased, so it affects every part of the body, especially the liver and these organs. So they cannot do their function properly. Precaution needed to stop bleeding. Universal precaution. So when there is the patient is bleeding, so what you have to do? Universal precaution have been drawn by uh, CDC in the USA and largely adopted by NHS in the UK. In summary, use of full face mask ideally or protective spectacles, use of fully waterproof disposable gowns and drapes, particularly during seroconversion, boots to be worn, not clogs, full length boots to avoid injury from drop sharps. Double glowing needed, a larger size on the inside is more comfortable. Allow only essential person in the theater, avoid unnecessary movement in the theater. Respect is required for sharps with passage in kidney dish. Slow meticulous operative technique is needed with minimize bleeding. You keep pressure on wound but bleed has not stopped. Why? Liver affection and deficiency of vitamin K dependent factor 1972. So 2, 7, 9 and 10. Thrombocytopenia due to hypersplenism and bone marrow suppression. Platelet dysfunction, vessel necrosis will not permit vasoconstriction. Vessel wall necrosis will not permit vasoconstriction. Endothelial edema occur. High pressure through the artery. So there will be no formation of clot and the bleeding will not stop by pressure only. Sequence of clotting: injury to blood vessels, platelet aggregation, platelet puck formation, activation of intrinsic pathway. So it will make fibrin mesh. Okay. Name two natural blood thinners in human blood. Two physiological plasminogen activator, tissue TPA, tissue plasminogen activator TPA, and urokinase type PA, Euro PA plasminogen activator. So what is one is tissue plasminogen activator, tissue type TPA, tissue plasminogen activator, and one is urokinase type plasminogen activator, UPA. One is TPA, one is TPA, tissue type plasminogen activator, and one is UPA, urokinase type plasminogen activator. Okay, so this is the end of this section, but since we have time 2 minutes, so we can go through this. So this is a vascular wall and there is a break in it. So what will vascular vasoconstriction will first occur, then there will be platelet aggregation, platelet phase, platelet aggregation will occur. Okay, this will activate the intrinsic pathway. Okay, factor 8, 9, 10, 11 and 12. Calcium common pathway, extrinsic pathway will be activated, clotting factor 7. Okay, so all these will work together to convert the prothrombin into thrombin, prothrombin to thrombin, and thrombin will convert into fibrin into fibrin, fibrinogen into fibrin. So the last result is fibrin mesh. So coagulation phase, clot formation. So they will form this mesh which will trap there, and they will form a clot. A clot retraction and organization further occurs here. Okay, and there will be then fibrinolysis, fibrin degradation. But during this time when fibrinolysis started, there is muscle, smooth muscle and fibroblast and the other factors, they have made the wall, like the cells are replaced properly. So wall patency is restored, wall maintenance is done. So this, remember, these clotting pathways are also important, so there are stations we will do this. So yeah, but overall this is the general concept. You at least you can tell them this as well, like since this is Y was stations, so you can tell them this as well. It's also enough.